afternoon. I am Camila. I am environmental engineer from Brazil, from the Ministry of Health. Can you hear me well? With cloud. I love that people are experiencing the different weather, the heat. I guess it can push us to go forward and find action. So I'm Camila, I'm an environmental engineer from the Ministry of Health. And we are creating the national program to wash indigenous water. The national wash program for indigenous people. Hard to translate because in Brazil, sanitation, clean water access, sanitation, and waste management. So we put all those together in the sanitation work. So in Brazil, it's only PNSI, which means for National Program for the Sanitation. But there's water and there's also waste management there. So that's the long story. So I work at the Ministry of Health with indigenous communities during wash programs. And we've been doing that. We've been doing that for a long time now, 15 years. And it's been a challenge to reach those communities that are far away and that need access to clean water and to sanitation. But not only access, but access adapted to their way of life. Which is why we are creating this program. So just to give a brief context, here in Brazil, we have more than 1.5 million indigenous people all across the land. They are in cities, they are in their communities far away, they are in the universities, they are doctors, they got everywhere. And we in PNSI, which is where I work, the Ministry of Health and Secretary of Health, we attend those communities that are far and that people are not giving them the access to their basic needs. So we attend more than 7,000 communities all over the country and more than 300 different people. So they have different needs, each one of them. Some of them are in very big communities that look like cities that have more than 20,000 people, and others are in communities where you can only reach by 20 days by boat. So to give a brief context, we are looking at a very diverse area. And today, the second leading cause of indigenous death is waterborne. So here we are in the climate change event talking about protection of the land, and we cannot provide that protection if we don't provide protectors of the land, which is the indigenous people, which is why it is so important to provide the basic needs to them. And yeah. So we are all over the country, and we attend those communities by districts, which are our offices all over Brazil. And those districts are distributed not specifically following the borders of the states, because the borders of the states were built thinking about how the cities are built. But when you think about the emissions, they're not necessarily following the borders, which is why we have the districts all over the country, mostly in the Amazon, as you can see, but all over the country, to provide this. And then to give a brief context about the laws and the history that the indigenous people have been through when it comes to access. We have a law here that was launched in 2007. It is the WASH law, and it provides them a little bit of push to have access. So they say that the policy has to provide environmental health conditions to indigenous people, but it doesn't really say how we're going to do it. So that was 2007, and then in 2014 they launched a national plan to bring wash to all the country, but then it didn't really focus on indigenous people. And then on 2015 to 2019, they started to build this program to rural communities. But then they actually realized that focusing on rural communities was not enough to reach those indigenous communities. Because when we went to listen to what they wanted, they said, listen, we're not only in rural areas, and also, if you're attending different communities that are rural, you're not giving the specific context that we need. So we need a program specific to indigenous people. And we listen to them, which is why we are creating the national program to indigenous people. Yeah. So here we are. It's been quite a ride. And I'm going to present to you today what's the program about and what have we learned so far when you work in this. So first I want to introduce you how we build the program. To build that, we have 4 different contribution levels. Those contribution levels were built thinking that we need to listen from all the stages that we work with. So we need to listen locally and nationally to the main actors that are working with the policies. So we went to listen to the different ministries, and a lot of ministries have different national policies that were working with all the Brazil, but we're not working with the indigenous people because they didn't even think about it. So we went there to say, hi, indigenous people exist. Maybe we could bring this policy or adapt it to reach those communities. Also, we reach to international organizations. Say, listen, you want to protect the forest and the earth? This is something you can do. You can actually protect the warriors, the protectors of the forest. We also listen to our own institutions, society, the Ministry of Health. We went to the local, the national workers, and we're like, what is happening? Why is it not working? Why do we have low access? What is your need that we need to put in this program? So we built a lot of workshops to do that. We also went to the sanitary districts, which are those, you remember the map that I showed you? Yeah, those are them. They're divided by that. They are the agencies that work locally. And we listened to the workers and were like, you are the ones implementing the policy. What is happening? What is your need? What do you need? And most importantly, we were listening to the indigenous community. We wanted to hear them say, what do you think it would be best for you? How do you want the public policies to reach you? So to do that, we hired 34 researchers that went all over Brazil, all over the indigenous communities, to actually listen to them. Yeah, you can ask. So they went all around. They spent a lot of days in those communities to listen to their needs and see how are they operating those solutions that are already implemented. So maybe they already have access to a water station, but what is really happening there in the community that is far away and that we are not there every day? And we listen to them and realize that sometimes they have to put chlorine in the water, and they don't have the tools to measure it properly. or sometimes it's very hard to operate, and the local operator has no time to rest. And when we talk about sanitation, we listen to some people don't actually want toilets. They don't use it. It's not part of their culture, and they don't want it. So we were putting toilets in those communities, but actually they were not using it. So those are some pictures of the researchers going on. They did a lot of very nice work. They went to schools, additional schools, to listen to the children, to listen to their needs. They also did like fire circle to present some of the work that we've been doing and listen to their needs. Yeah. We also did national workshops with more than 50 leaders all over Brazil, and regional also, and also regional all over Brazil, regional workshops to listen. And I think the main thing that we realized is that we were sometimes providing solutions that were not really solving the problem. And once we listened, we realized what we actually need to do. Sometimes it's even less effort, but it's more efficient. So we did other activities to build a program, like cost assessment. We measured the growth estimation because the program will last 20 years, and we expect to reach everyone in 20 years. That's our goal. We identify strategy, we did work site planning, and to reach that, to plan how we're going to reach everyone. First, we wanted to answer one main question, which was, how is access defined by Indigenous people? Because we are here talking, we have this much access, or this is what we need to do. But first, we need to listen to how is access defined by them. So we made a workshop about that with the Indigenous people. We made this question over and over when we were reaching those communities, and we learned a lot from it. One thing that we learned in the program is that in every situation, the Indigenous community have to be consulted. So if a solution is there, but the community was not consulted, the solution is not considered the right practice. And why is that? Because we learned that when we were in those communities, sometimes when you see the data, you look at it, and it looks okay, but then when we listened to them, they were saying, look, this is not actually working. So, in those communities, we are hiring what we call ISA, which is the Indigenous Sanitation Waste Agency. And in there, he is the one talking to the community. He is an Indigenous leader who's there to build the bridge between the community and the public policy. And what he does is he operates the system, implements it, he talks to the community about the hygiene strategy. He's actually the one who's leading the wash in the community. And with that, we made those actions programs. So those are some of the systems that we implement, what it looks like. And you could think that we could maybe implement something more simple. But one thing that we also learned is that it needs to be simple because they don't have the tools to be giving maintenance all the time. But also, it needs to be effective. Because once it stops working, then it's not giving access anymore, right? So if we only implement those simpler solutions that are not that is easier to give, sometimes it's not resolving the problem. But those just something that what it looks like. And one thing that we also learned is that women and children are the main actors of wash in those communities. Those children are the ones getting the water. Those women are the ones who are going to the river, sometimes walking for half an hour, for 1 hour, carrying in their head the water to do their basic needs, to have their basic needs. So that is what's happening in the community. And we have some of the pictures, but that's what we saw all over. And also, we found out that they're creating intelligent solutions to what they have. Solutions that sometimes are very culturally adapted, maybe like a way to carry water, or even water drain with what they have. So we also understand that we need to listen to what's already happening there. So we don't come with an outside solution without seeing what's already there, what's working, how they are building solutions. They have knowledge. No one lives without water. So they have water. How is that water going? What are they doing? How can we improve? We also understand a bit about how the community matters. And when I say that, I mean that to implement a good solution, you have to understand how it's socially the community organized. And what we saw that sometimes a water system is implemented close to a house of someone that doesn't get along with the other person. And then that other person doesn't have a water because they can go close to it. So that those social understandings are very important to provide water, which is why we can't just go there, look for technical information like, this is the river, this is where I'll build a well, and then don't look into how the community actually is organized. We also learned that in some cases, they have traditional drinks, and when we put chlorine in the water to help to prevent waterborne diseases, their traditional drink doesn't ferment. So it's a culture that they have to have that water without fermenting their drink. So how can we build it? We can only know that that's one need of that if we actually are there, which is why decision agents are so important, because when he is a part of the team, he's part of our team, but it's actually part of the community too. So we have someone from the community with us who are listening to the community needs and who we can listen to build better solutions. Okay, so this is the situation that we're facing all over Brazil. And how can we improve that? Okay. So we are building the PNSI. The program is structured in 5 axes. We have one based on infrastructure and technology. The other one is management of the indigenous wash systems. The third one is about health education of wash. The fourth is cooperation, partnerships, and coordination. And the fifth is participation for social programs. And in those 5 axes, we build guidelines and strategy to listening to them, to actually know what we're going to do, how we're going to get those numbers higher. Those accurate numbers higher. So the first act is about ensure that the wash infrastructure reaches all those needs. And the second one means that we can only provide this structure. But we have to ensure that the efficient management of this structure is provided. Also, we have to train the team with learners to guarantee that the community have access to the education needed to operate, to talk to the community, to know what to do and what not to do. The fourth, we need to secure aligned partnerships, share responsibility. We know we are talking about 24% of us, very low number. And to get it higher, we know that we need more hands. So to ensure partnership is very important. And also ensure that Indigenous people are the main actors of the program. So we don't want to only listen to them, but then we want them to be the one leading them. So that's where we are now, pretty low. And that's what we want to get in 20 years, pretty high. So we have a long way to go. And the program is very efficient, I would say. But it's what we need to do. And I guess this is also an invitation to collaboration. We are building a structure to monitor it and evaluate what we're doing to see if it's working. We have the coordinating team, executive team, the execution team, but also a governance structure. And we are building inside the program a network for Indigenous Water, which is a network of different partnerships to actually get stronger and get more hands into those communities that actually need us. So we already have a network with more than 200 organizations here in Brazil. Those communities, those organizations sometimes already work with the Indigenous. Sometimes they don't. Sometimes they're saying, hey, I don't work for you, but I want to. How can I do that? And what we want to do with the network is ensure that when they are doing so, they actually do it in the proper way. So partnership is a key foundation for association, and we want to collaborate. The National Water Program for Indigenous people is being developed with full awareness of the challenges and the structural gaps that we have. It has the potential to really revolutionize Indigenous water, which is very, very much needed. And yeah, we should build it together. So if anyone have any questions, I'm happy to answer it. Yeah. I'd be interested to learn more about your coordination with other ministries, particularly sanitation, water, and infrastructure ministries. So I see here it's a different setting. So I'd be interested to learn how that works, and also in terms of funding for the program, whether the funding to be connected from to the Ministry of Health or to other ministries that really are engaged in facilitating the initiatives. Yeah, thank you for your question. It is a very good one because you're right. Here in Brazil, most of the sanitation, the water and sanitation programs are related to other ministries. And the Indigenous Sanitation and Wash is in the Ministry of Health, which was a demand by the Indigenous movement. And they demanded that because they wanted an organ specifically for them, an agency specifically for them, which is why we exist, because of their demand. And this is very good to attend their specific needs, but also it's challenging because we sometimes are far away from other national policies that are built and they don't remember that the Indigenous people exist. So it's something that we are really working to come closer to them and try to say, hey, we exist, we're here, we like they need it. And Brazil have a goal to reach everyone has water and sanitation by 2033. And by that, it's very close. Like we're so close, and we can only reach that in the indigenous community that because they are one of the main gaps in access. Right? So we are talking and doing kind of an education awareness action with those different ministries that sometimes are very city orientated and actually want to sometimes private sector wants to be there but don't want to attend those very farm communities. So implementation is very hard to walk to indigenous people, and when it comes to finance, we have a very hard we have a hard time because we are inside of the Ministry of Health, and the Ministry of Health will be the one implementing the program. But we have to the money is limited, right? And we have to like fight for the agenda inside. So it's not guaranteed. I can't say it's guaranteed, but to implement the program, we need a cooperation because I think by cooperation we have more chances of having this implementation guarantee and having more hands. I believe that cooperation is a very crucial tool to implement. I don't know if I answered your question. Anyone else? I'm hosting the University Association of Water Resources. Thank you for the presentation and for the initiative. My question is, I'm with about the National Agency of Water was formulated relationship between the indigenous people and rivers, and the trouble that we have is the water collecting in the rivers when they are in cycling. Yes, thank you for your question. We actually included a water agency. We actually came together with work group with different sectors, and although it was one of them, water agency was one of them, and we talked to them about water quality to the rivers. One of the demands that was listed by the indigenous was that we cannot only provide water in taps. They have specific needs that only the river can provide. Might be spiritual needs, might be just maybe going to the river to bath, or just the connection they have. So we talked to them about that, about ensuring water quality in those areas, and sometimes they said that they had a difficulty in getting inside those territories because they're far away, or because maybe they don't have workforce to reach there. But we talked about how we could be together in that, and we want to strengthen that. So getting there, and I think the program is a tool for that, for strengthening our collaboration. Jessica mentioned something that I forgot to say, that we are actually in partnership with Ministry of Environment, and they were building the 5-year plan, And then in the climate plan, we were talking about how we could put a goal to prevent, to bring protection to springs in indigenous territories. So that was something that is not what we specifically do because we are more related to the infrastructure, not to the environment protection, but it's really related. So we've been strengthening that partnership with them so we can think about how we can actually protect that land, and by that we can provide better access to water quality. Do you? Just gonna repeat your question. So maybe I just didn't understand right, but you're asking about how the climate plan and the national plans are talking about environmental protection that related to national watch. Is that what it works?
With the indigenous communities. To the indigenous communities, like those policy considerations.
Sorry. Yeah, we've been talking to the environmental ministry, and when they are the ones leading the environmental protection plans and the climate plans, and we actually managed by the creation of the program to put goals in there that are specifically related to environmental protection in those territories because it's very related, and also to wash goals. So one of the goals, for example, is having systems that are climate resilient, because sometimes in the Amazon, and I don't know if you can even imagine that, but the rivers that are this big gets dry in one season, and those rivers are not only the main source for their basic needs, but it's also their paths, their ways of transportation. So those communities, when they are in the dry season, they also have difficulty by getting access to every other public policy. So we talked to the environmental ministry, and we talked to them about how we can, in the climate plan, put some goals related to those water systems. And to think about how in those dry seasons, but also during floods, how it can be more secure. Actually, also building water security plans. That's actually one thing that we're doing too. Anyone? So we are open to collaboration if anyone wants to speak. And tomorrow we'll be speaking here too with other partners at 9 a.m. And you can learn more about the program. Thank you very much.
Okay. Kijk eens.